This podcast is hosted by licensed therapists, but it is not a substitute for therapy. The content is for informational and educational purposes only and does not constitute professional advice or a therapeutic relationship. If you are in need of mental health support, we encourage you to consult a licensed mental health provider in your area. I'm Dr. Marissa Eusebio.
I'm Dr. Anna Abaruz.
We are licensed psychologists and we're moms, but we are not your mother's therapist.
Not your mother's therapist. Not your mother's therapist.
Well, welcome to another episode of Not Your Mother's Therapist.
Back.
With a bit of a twist today.
Yeah.
We have our first ever guest on the podcast.
Special guest. Incredibly special because you're our first one.
Yeah. You will always hold that title.
Yeah.
So welcome. This is Dr. Celeste Poe. She is, and let me make sure I don't get this wrong, but she is a clinical assistant professor at Stanford University and a NICU psychologist. Hey, Celeste.
Thank you for having me. I'm so excited to be here.
Yeah, absolutely. We're so pumped that you could be here. So just, why you're here today, I know Celeste from, at this point now, many years ago. Celeste and I went to grad school together. And we're, I'm going to say attached at the hip while we were in grad school. There's nothing quite like having someone come alongside you in grad school that you go through absolute hell of it.
The hardship.
The hardship. And then it just kind of bonds you forever.
Right.
So that is mine and Celeste's relationship. And now you're just this badass off at Stanford University doing incredible things.
Mm-hmm.
Yeah, it's amazing that somehow I think for a long time in grad school, our age ranges were so separate in terms of who we worked with. And now we're both in the maternal mental health space, which is so special.
Yes, it really is. So actually, why don't you say a little bit about that? How did you get to be a NICU psychologist and what's your background in training?
Yeah, so before we met in grad school, I had completed a master's in marriage and family therapy. So I was licensed as an MFT before that. And as with all licenses, there's clinical training along the way. And I was really lucky in that my early clinical experiences were a sort of love at first sight sort of thing, which I know doesn't happen for many people. I know throughout training, usually you get the opportunity to kind of work with a lot of different populations and decide what seems like a good fit. But pretty early on, I was working in early childhood and in particular working with the 0 to 5 population as early as pregnancy, also with a lot of children with childhood trauma. And it was immediately, I was just there's something magical about this period of time. I think in particular, there was an experience that I had where I got to observe a lot of mom-baby groups and a lot of mom-toddler groups, and just seeing that relationship, it was, I can't say it any other way but love at first sight. I was this is the most magical thing in the world. And why doesn't everyone else want to work in this population? And so I was hooked from the very beginning. And so then when I continued with training, the piece that I felt like I wanted to add to that was more of a sort of health psychology approach. So I really liked early childhood. I really liked trauma, intergenerational trauma, but health psychology and working in the hospital setting and sort of helping families navigate that was what I started to do more so later on. So at the time in training, it was in pediatric oncology and sickle cell disease. But I really wanted to find a way to sort of marry the early childhood population and also health psychology. So there was an opportunity that popped up to do some extra work in the NICU during grad school. And I was what is NICU? I remember Googling it and figuring that out. And it was just wow, this is such special work. I want to find a way to continue to do this. So fortunately, I had the opportunity to sort of continue that interest on internship and postdoc, sort of multiplying the time I spent with NICU families, even though that wasn't part of the traditional structure of the internship, or creating my own practicum experience, to be able to have a rotation in the NICU. And then it all came together when a job opening opened up at Stanford. And I was this is where I meant to be. And so here I am.
Wow. So basically, we all started off as like kind of being really focused on trauma,
Mm-hmm.
and then we ended
Mhm.
up in kind of like the reproductive, like mental health, like space in
Yeah.
a way. Yeah.
Yeah, we
Wow.
absolutely did. And for a long time in grad school, often, so like there are little like pod of grad school friends. I was the only one that was adult trauma, and they
Mm,
all were child trauma, and they
mhm.
were all trying to convert me. And I was like, no, I'm not. I'm not entering into the child trauma space. And then I would try to convert them, and then somehow me and Celeste we met in the middle, right, with like maternal
Mhm.
mental health and reproductive mental health, which is really cool. And Celeste, you also did a joint internship and postdoc at Yale Child Study Center. And I just want to say that because that is an incredibly challenging internship and postdoc to get. And I know that you don't like bragging about yourself. And I like to brag about you. So I'm going to do it for you. Because like I said earlier, you're truly a badass. So I think one of the things I want people to take away from this is just like,
Celeste is a badass.
yeah. If you don't take anything away from this episode aside from that, like I'm perfectly happy with that. Celeste is an absolute badass.
That is so funny. I think actually your point about the child versus adult kind of thing, I remember because our program is joint, the internship and postdoc is together. You can't like go off to a different postdoc. But I remember even though I was child and adolescent psychology trained, I like always wanted to work with parents. And so the hard part about training though is that there's not a lot of programs where you can do that. It's you're
Right.
either child or you're adult. And so it's been really nice and kind of strange to like only work with parents now in the NICU because I'm so used to, training with children. But I think the world of perinatal mental health, it's very gray. It's not black and white, like
Oh,
in
yeah.
terms of who you're focusing on, which is why I
Wow.
love it.
Yeah,
Mhm.
that's deep. It's not this like separate thing. It's all kind
Right.
of one, really.
Yeah, it's all interconnected.
Yeah.
Mhm.
And so I think we want to spend some time today kind of first talking about, Anna, your experience in the NICU. And I think one of our hopes by having this discussion is talking about what you and your family essentially went through without necessarily trauma dumping.
Exactly.
Because it can be really hard, right, when we're talking about some of these very challenging experiences. I mean, being a NICU psychologist, a trauma psychologist, right, that in itself is very heavy work. So we're not wanting to trauma dump on people, but there are a lot of parents out there who have experienced this or maybe unfortunately will experience this, maybe know someone in their life who's gone through this. So I think it's a very important to talk about, a very important topic, there we go, to talk about.
Yeah, there's a lot of things that I think people can take away from just kind of hearing, I think, about a NICU story, and then also having a NICU psychologist here to kind of talk about, like, some of the research and the sciencey stuff too. But I will say this, because we had a mutual friend who we told that we were doing a NICU episode on, and she went through her own NICU experience, and she was like, I actually love listening to NICU stories. And I was like, oh gosh, why? Because I don't. And she said, because I love like hearing happy endings, if there's a happy ending. So I will say, huge disclaimer here, I had the happiest of all endings. So if that's like a criteria for you to listen to this story, I was the 1% of the 1% of the NICU's people that like left the NICU. So this is an incredibly happy ending. That it was very scary there for a bit, but it was a happy ending. So disclaimer for that.
Yes. Yeah. And Celeste, we didn't say this before, but I know this can be a little hard, like since you're not in the room with us, but please interrupt
Yes,
Anna,
please do.
as especially she's like kind of going through, her experience and story. Don't hesitate.
Yeah. So I'm just gonna like share a little bit, just I guess, so that everyone listening can have like a sense of how bad it got, to some degree. So when my son was born, he was, completely healthy. His APGAR score was like really high, which your APGAR score is like this like number to see like how healthy a baby is, very high, right? And then so we went home, and I'm just there, and I'm experiencing the best parts of motherhood. I remember I told you like 3 days into having him, I was like, this is great. I want another one. This is amazing. I love motherhood. But when he was around 3 weeks old, we started to notice some like flags that we couldn't like pinpoint. I actually remember you were over my house one time, and remember he was like, he had been doing this like grunting thing, and I was like, Marissa, does your son like do this? Because our kids weren't that far apart at that point,
Right.
and you said no. And I was like, oh.
I was at your house. This conversation happened the day you took him to the hospital.
Yeah, you literally left, and I thought about you saying no, and I was like, let's go take him to urgent care. Like just something, you know, sometimes when your gut just tells you something. So we did take him to urgent care. The doctor looked at him and said, no, everything is fine. It looks like, you know, he's been doing a lot of crying. His voice is hoarse from crying. Like, but it's, you know, I think what I'm basically diagnosing, what we walked away with, is that he's a colicky baby. And we're like, oh, crap. Okay, well, this is a lot of crying. Wow. I mean, colicky is really intense. So we took him home and we're like, okay. And, you know, 2 days passed and I was holding him at one point and he started to feel a little hot. And I was like, oh, crap. So we took his temperature and he had a fever.
Which, for those without little kids, if your baby is it
under a month?
1 month.
Under 1 month.
2 months.
Probably everyone says something
1
different.
to 2 months.
Right.
Right. If your baby's under 1 to 2 months, any amount of fever is considered a medical emergency.
Medical emergency.
Like you go to the
have
hospital.
Go to the hospital.
Yeah.
So we did, right? So I saw it, and like I didn't bring anything. Like exactly how it was, we went straight to the ER as soon as we saw his temperature, right? And we got to the ER, and the ER was full. And I remember thinking like, oh my gosh, it's gonna take forever for us to get through this. I started crying in like the list, and like in the line just to check in. I started crying because I was like, oh my gosh, like I thought this was a medical. Like there's so many people here. We told the person to check us in, and she immediately took us back.
Oh, wow. I didn't know that.
Yeah. So I was already like, oh crap, this is pretty scary. They triaged us. We went to the ER, and they started saying that, you know, when a baby has a fever like this, we need to run some tests. Like we need to do a spinal tap on the baby. And a spinal tap is when they literally poke your spine to try and get cerebral spinal fluid.
Mm-hmm. And can I just interject really quick? How old was your son at this point?
3 weeks.
3 weeks.
Yeah.
Mm-hmm. So 3-week-old getting a spinal tap in the emergency room.
Yeah. Yeah. And honestly, that is like one of, I think, probably when I think about like what has been, I've had therapy about this, so I've been able to like really process and think about like this whole experience. One of the things that I think was probably the hardest, like top like 3 hardest, was all the different medical tests that he had to have done. It's really, really hard when you're a new mom to watch your baby go through pain. Mm-hmm. And you can't stop it. Like you can't do anything about it. Yeah. And I was 3 weeks postpartum, right? So I had a very hard delivery too. So like I was recovering, like my body was not 100%. Mm-hmm. And also I had just left the house and I forgot to replace my milk catchers, like my pads for my bra. And so by the time I got to the ER, like I was soaked. Mm-hmm. And also hearing him cry, for some women, and I'm one of those women, when you hear your baby cry, milk starts coming out. So I'm soaked. I mean, I was soaked in layers of breast milk. It had come out and then it dried and then it came out again and then it dried. Like every time I heard him cry, and I couldn't feed him because they were doing like some kind of testing or whatever.
Right.
So they did the test. They gave him some Tylenol. His fever was going down, and we're thinking like, oh man, he's got RSV. But you know what? We came here right away. He didn't have that, like, you know, he didn't have that, like, he didn't have to sit in the fever for a long time. So I think we're good. Right. And we're thinking he has RSV.
Right. Because this is also November.
Right.
So it's smack
RSV
in the middle.
Super high during that time and stuff like that. So I remember telling it was like midnight around this point. We're still in the ER. They're like, we have to run some tests. We might take him up to the NICU. And I told my husband, I was like, you know what, just go home. Just like, you know, we're going to be here a long time. I'll call you in the morning to come pick us up. That's what I was thinking. Mm-hmm. I was like, you know, it's going to take forever for them to discharge us and all this stuff. So I'll call you in the morning. And so I told him, just go home. So he went home. And then around 3 o'clock in the morning, they basically said, we have a bed in the NICU for you guys. And I'm like, okay, I go, whatever. It's just standard procedure stuff, right? The NICU is like the ER of babies. So that makes sense that he has to be there, not here. So then we went up. And that's when everything kind of fell apart. And when I really realized the severity of what we were dealing with, um, when we've done like conferences and trainings on NICUs, they often talk about, and I'm curious if you've heard this, Celeste, like the first time that you see your baby in the NICU getting hooked up to wires is and put in I think, what's that thing called? The incubator?
Isolate, sometimes they call it, but yeah.
Yeah, that the tube, the glass tube where the baby has to go in and be put into like a bunch of wires is an incredibly like traumatic like moment. It's like the singular moment that a lot of parents remember. Have you had that experience of like parents sharing that with you?
Yeah, and I know obviously people have different journeys to the NICU, but sometimes that's like a parent's very first time seeing their baby is like
Yes.
when they're hooked up.
Right.
And so yeah, it's just baby's so small at 3 weeks and all the monitors and machines, it's overwhelming.
It's overwhelming, yeah. I think the hardest part for me too is that once they put him in there, I couldn't hold him. So he was crying and crying and I couldn't hold him. And at that point, the doctor looked at me and she was like, we're very concerned. And it was a period like that. Like, we're very concerned. And I think I knew something in my gut was telling me that, like, this is how she tells people we're not sure if your baby's going to make it. But she's not going to say it that forward. So that directly. And I was like, wow, holy. And I just, this was a really interesting experience for me because this was the first time that I experienced a trauma as a trauma psychologist.
Right.
So I'm watching myself go through all these things that I hear all my patients say, right? Fight, flight, or freeze. Like, I'm in a freeze. I'm completely like, boom, depersonalized. I do realize like all of it. I'm literally like, this is a full-on criterion A. Like, I'm watching it happen.
You're not watching it happen. You are experiencing it. You're in the middle of it.
Yeah. And I guess I said I'm watching it happening because to some degree there was some amount of dissociation in there. Like, I was literally, like, when I remember that event, like, I was watching myself almost.
Yeah.
And I remember the doctor looked at me and she was like, "Are you okay?" And I was like, "No." And like, I wasn't crying or anything. I was just straight up just, and I'm by myself here and they're, and they're plugging him up. He's got 20 different wires on him. He's in the little thing and he's crying bloody murder, which is actually a good sign. When they're not crying bloody murder, that's when you should be worried. Yeah. So he was crying. So he was a fighter and they were like, it's good. That's a good sign that he's crying like that and really pissed off. I was like, okay. And then, I was like, how long do you think we're going to be here? And they said, you're going to be here for a long time. And I was like, oh, like tomorrow, maybe the next day. She's like, 4 weeks. And I was like, what are we dealing with here? This doesn't feel like RSV anymore. And we still didn't know what was happening. But so they had to run a bunch of tests. And there was one nurse who was a mom, I learned later. She like pulled me and she said, why don't you come like rest over? It was like 5 o'clock in the morning. I still hadn't slept. I'm covered. I smell. I stink. Like, I'm covered in breast milk. I'm, just all. She was like, why don't you, let me just take you into this room with this small couch so you can like rest. And then she brought me in there. And I don't know if the universe has a cruel sense of humor, but the room that she brought me to was like the angel's room. I don't know what it's called. It's like the white angel, like something room, but it's the room where they bring parents to tell them that their baby has died.
Oh, no.
And I was like, God, there wasn't another room that we could have gone to? Like, this is the only room? Oh. And then so she like left me on the couch. She's like, do you want anything to drink? Like, feel free to lay out on the couch. And I was like, yeah. I could use something to drink because I hadn't drank anything or eaten anything in like hours. So I was hungry, thirsty, tired. I hadn't slept. And then she left and it was the first time that I felt it all. Like I think because I needed to go away from my baby in order for me to feel my own emotions. And I just started what I can only describe as like wailing, like actual like mother's cry, wailing, like this very, like I've never cried like that in my life. And then the nurse came back in and she started crying. And that was the first time that I had this understanding. I learned a little bit later that our story is not the common one in the NICU. I think you're kind of alluding to that, right? Like a lot of parents have premature babies and that's how they end up in the NICU, right? So they're at the NICU to like row a little bit and things like that so they can be ready to go home. But to bring in a full-term baby when you don't know what's going on and they're sick is not the common story in the NICU. And so I started to, throughout my like kind of journey in the NICU, I started to realize that I think my experience had a big effect on the staff there. When this nurse came back in, she started crying with me, and she cried. Like she wasn't trying to hide it. It wasn't like a tiny tear. She was like, she held onto my shoulder and she started crying with me, and she was like, "Can I pray with you?" And I wasn't terribly religious, but I was like, this makes her feel better. So she's obviously religious. And I was like, yeah. I don't know why I felt this urge to want to protect them from the experience, because I have to go through this. Right. But this is just a regular Tuesday for them. And I don't know how many of these experiences they have, So I was like, yeah. So she prayed with me. And there was multiple nurses like throughout my experience that like cried with me. And that's very touching because a lot of them were moms.
Right.
So I think actually, Celeste, this is where I want to bring you in as staff in the NICU. What's been kind of your experience like having to hear all of these horrible, like traumatic events that people are going through, and working with the staff and working with the nurses and all that stuff?
Yeah, I mean, just to be honest, I feel like really moved from hearing your story. I've never heard your story before. And so I'm just like really struck with the way that I think that you told the story. It was also, I felt like I was right there with you.
Yeah.
And I feel like that reflects your ability to like get the support that you needed to process the experience, because I think when you're in the middle of it, you don't really have, it's like the last thing on parents' mind usually. And so it's so nice. We are very privileged at Stanford to be able to have a NICU in-house.
Oh, for sure.
And so I think like it makes it easier then for a parent to be able to like, okay, yeah, like I'll, start processing some of that. But I think as a staff member, depending on what role you play, you get a lot of different versions of parents going through one of the most difficult times of their life. I often say that as psychologists there, we have a lot of privilege. I think we're not under a lot of pressure to have answers medically for the parent or to fix what's happening for the baby. And so that in and of itself, I think, is a lot of privilege. But then also we have a lot of time with parents. So I think like, for example, the neonatologist, who is at sort of the top of the hierarchy in terms of like leadership in that setting, doesn't spend a whole lot of time sitting and talking with parents. They don't have the opportunity to do that, but they have a lot of pressure. So it's this weird thing where I think everyone has a different vantage point. And all of us have difficulty and responsibility to the families. And so I really respect what everyone brings to the table. And I'm like really thoughtful about the reasons why one provider might have a harder time with a certain story versus another, and just how to navigate all of that. I think, again, if you're a parent, that's also another thing. I've heard many people say that they worked in early childhood or they worked in the NICU before having children.
Oh, wow.
And then they had children, and how hard that was. I've heard people actually change the role that they had because of how challenging that is. So I think that there's a lot of like personal identities that make it challenging. But also it is challenging work. I think, like you said, we all come from trauma work, right? So I like knew like what to expect, and I've worked in early childhood trauma. So I've seen some really difficult things. But when I started in the NICU, like a few weeks in, I was like, oh, I'm having vicarious trauma. Like I can see the symptoms. Like, this is what they talked about in class, right? This is what we learned about. I was having it to a T, but I also loved the work. It was just the most soul, like, it touched me on a level that none of the work I've ever done
Yeah.
ever has. So I loved it, but I was also struggling, and that was really challenging.
Yeah.
So I think it's an interesting place. It's also kind of intense. Obviously it's an intensive care unit, so people aren't usually like super soft and fluffy with each other. People are like moving very quickly.
Right.
So I think like being rude, being embedded there and having people know who you are, knowing who other people are, and being able to like share in the experience and how difficult it is, I think is a huge factor for how well you do
Yeah.
working in that setting.
Oh,
Mm.
100%. Just having a NICU psychologist there, because
Mhm.
that, I mean, I didn't have one. I never had a psychologist like reach out
Right.
to me in the NICU. There wasn't one. I don't think there is one at the
Right.
hospital that I was at, and a lot don't.
And I think the hospital that you were at, and I'm curious what it's like at Stanford, Celeste, but the hospital that you were at was a major medical center
Major.
with a level 4 NICU,
Yeah.
which I think is the highest level. Is that right,
Mhm.
Celeste? Level 4. Is Stanford also a level 4 NICU?
Mhm.
Yeah. So that's what kind of blew me away, is that this is
Yeah.
the hospital you were at. Is very similar to Stanford, right? In terms of like how robust of a medical center it is.
Yeah.
And the fact that there was no NICU psychologist
Yeah.
is wild to me. I
It's
literally
wild.
thought about emailing them. I don't think I ever told you this, but I thought about emailing them and be like,
Yeah.
I think you need a NICU
Yeah,
psychologist.
seriously. There was a lot of things that weren't there. I do think that one thing that I'm probably going to get into at some point is just more advocacy around the NICU experience for families,
Mhm.
because it was very hard on our family in ways that it didn't need to be. Right? Like your kid is going through this, that has to happen.
Mhm.
But, for me, like, I told you, right, I was sleeping in my car for weeks because I was a breastfeeding mom and I wanted to be able to breastfeed him the whole time.
Can I ask, actually, I had a question about that. So the hospital that you were at, did it have like a space to sleep there? Did they have other sleep spaces? What was the setup like?
No.
None,
None
no
of it.
to.
Yeah, I think it's just no period. Like
No,
there was
period.
nothing,
Yeah,
right?
there was none of that. Yeah, it was a really hard environment because I wasn't allowed to have any drinks there, but I was there all the time. So anytime that I needed to drink some water or something, I had to leave. Anytime that I needed to eat, I had to leave my baby. And at 3 weeks old, I don't want to leave him for anything. Like he's a baby, he's struggling. Like, no, this baby will be on me the whole time if I can. So I was thirsty, I was hungry all the time.
And I just have to remind people, you're 3 weeks postpartum,
3
right? So
weeks
you are
postpartum.
physically recovering.
Yeah.
And on top of physically recovering, you're also in the early stages of nursing, which means that your hunger and thirst is insatiable.
Insatiable.
Especially thirst. Like,
and engorgement.
Right.
Engorgement, like from breast milk. And they actually decided that like he wasn't able to, they had to put him on really strong antibiotics, and they said he's not going to be able to eat for 2 days because he might choke on his own vomit from
I did
the
not know this.
Yeah, so I was engorged, and I also was too overwhelmed and too in the middle of all of this to figure out how to work a pump.
Right.
And I had no idea. I was a first time mom. Like I'd never pumped. I didn't know what a flange was. I didn't know I hadn't even taken it out of the box. And I couldn't even put my mind together to pump. And thank God for this one breastfeeding consultant that was there. She just, oh gosh, I forgot about her and I'm remembering her. She just scooped me up and was like, I got you. She like, she knew. She didn't teach me how to work the pump. She said, I'm gonna set this up for you every time. And
Oh, wow.
and she hooked it up to me, and like she just started it, she ended it, and she was like, I'll come back in like a few hours and do it again. Like she immediately read the situation and was just like, don't even worry about it. Like, I got you.
Wow, that like gives me chills.
I know. There was just a lot of people there that were really awesome. My neonatologist was really awesome. He spoke Spanish, so he was able to explain everything to my mom. And
Oh, wow.
yeah, and a year later, we actually went back there to see him, and he immediately recognized us because, again, like it was a very intense situation for my son, and so I think a lot of people, the staff that was there, like really remembered him. Long story short is that I will say, so what he ended up having after several days of being in the NICU, sleeping in my car, coming up to feed him, going back down to sleep in the parking lot for weeks, is that he had a posterior urethral valve that they didn't catch in the ultrasound. And usually when they catch that in the ultrasound, it's immediate, like fetal surgery, right? Like in the womb. They didn't catch it because he had a very mild case.
Can you say what that is? Because to me I know what it is now, but I think if I didn't have, I've heard your story, I would be like, that just sounds like a different language to me.
Can I tell you something really funny?
Yeah.
I'm not even really sure. And the reason why, and actually, Celeste, I remember last time that we were at a conference together, you talked about the importance of the couple in the NICU and their relationship. The NICU experience sucked. It sucked. But the one good thing that I will say, there's actually two good things that came out of it. The one of them was me and my partner, like whatever, I don't know what happened, but we freaking clicked. Everything was just, we were on like the same wavelength about everything. When I think about like, when were we at that top, highest, most effective relationship that we've ever had, it was in the middle of that NICU.
Wow.
Yeah.
And Celeste, I think you can probably confirm this. I think that that's probably extremely rare. And you're probably one of the few kinds of couples that like the strongest at your eyes when you're in the NICU. Celeste, what's your experience been working with those parents?
I have heard this before. I think it's one of those things where like going through a traumatic experience, it tests you in ways where sometimes like you're able to really lean on certain things like your relationship with God or your partner. In some ways it really tests that, and it kind of can get a little messy, or it kind of shows some weaknesses. I have heard this before, but I do think you're right. I think that the majority of the time it's actually that couples are coping very differently. But it is one of those things that you can look back on, and kind of amazing to be able to say like that was like a peak moment for your relationship.
Yeah. And going back to your question about what did he have? It's hard for me to even understand what was happening, because Jacob knew. Like, it's like he picked up on that, like, your mom, you need to breastfeed, and like your entire responsibility is that, so I'm going to take care of everything else. So when they did rounds, he was there. He was talking to the doctor. He was saying this, we need to run this test. We need to do this. Well, what is this? We need to rule this out. He was like looking things up. I mean, he understood everything that was happening backwards and forwards. And to be honest, the reason, I genuinely think a big reason why our son like just came out of this so well, and he was like a miracle case, is because of him. It's because of Jacob, because he was just, there was nothing he didn't let slide. He'd look at the catheter that the baby had, that our baby had in it. He'd be like, that needs to be refilled. Like, he was just like the amount of advocate, like he was just on it. And I didn't have to worry about anything. I was just, all I did was do skin to skin and breastfeed with the baby. And that was it. And he took care of everything else. And that helped me to some degree, because I almost didn't want to know how bad it was. But to answer your question, it's this valve that's there, and what if left, like if you don't catch it, it has severe consequences. So the valve itself is not terrible, but if you don't catch it, then it has severe consequences. And then so what did happen is that because it was almost like his urine was coming back into his body, he ended up having E. coli in his brain. So that's kind of why they did the spinal tap, is to figure that out. And with E. coli in his brain, that could lead to all kinds of, cerebral palsy, like hearing issues. I mean, the amount of things, and you don't know right away.
Right.
And you won't know for
problems,
months.
I think, was another one.
Kidney problems,
that was a potential.
Yeah, all of those things. But he was definitely like my rock during that whole thing. He just took care of things, so that was huge.
Yeah.
But I will say, so that was one of the good things that came out of the NICU experience. The other was just my love for moms came out of the NICU experience.
And one thing I do want to say about this story, so, I mean, actually, do you want to speak a little bit about how your son is doing today and like all the follow-ups, right? Because he's almost 3. He's pushing 3. He'll be 3 in a couple months. So can you just briefly talk about like where he's at today in terms of any side effects, anything like that?
Yeah. He doesn't have any, actually.
I know, I was asking that question, and I was like, I know the answer.
The
answer is none.
He is a completely normal developing baby, no health issues. I mean, the doctor at one point was like, why are we even having follow-ups anymore? Like, let's just, call it there. Like, and they told us, they were like, I've never seen a baby have that. He is in the 1% of the 1%. He is an
Right.
actual miracle case.
Mm-hmm.
And that
And a
wasn't the
miracle
case.
case not only for survival, but for all of the
The
follow-up things,
follow-up things,
the
yeah.
potential of complications later in life,
Yeah,
and
because
health
we didn't know for
issues.
months.
Right.
After
I
that, we
remember that.
really thought like, he might have cerebral palsy, maybe like a mild case of it. I guess we'll know by developmental milestones. The other one was hearing issues. The other one was needing a catheter to urinate for the rest of his life. Right. So we're just like, once the NICU was done, we spent almost 3.5 weeks in the NICU. It wasn't done there. He went home with a PICC line. So if people don't know, a PICC line is a little like freaking thing that like a line to receive like antibiotics and things that goes through your entire body. He still has the scar for it. And we were administering that medication to him, me and Jacob, for weeks after the NICU, through the PICC line. And it wasn't until my therapist asked me this when I went to like kind of process all of this. She was like, what was the moment that you knew it was all done? Like you were good. And it was when we did the hearing test. And I remember, and I have a picture of me like holding him, and just because you have to like hold him very still for an hour while they do this hearing test because he has to be asleep for it. And I just like, I was like holding back tears, trying not to move for a whole hour because I knew this was like the last thing that we needed. And she was like, the hearing test doctor was telling me pretty much for the entire time after the NICU, anytime we went to go see a doctor, all the doctors like would come into the room and be like, are you guys okay? Like after they would read over his medical records, like it was like that much of an impact for everyone. And she was telling me that like I had a baby just like you guys come and he lost all his hearing and all this stuff. And I was like, great. And so I'm like holding my baby. And then
Maybe
she
that's
like,
not the thing that we say right before you do
could have
a
left that
test
out.
like this. Like, yikes.
And then she just looked at me and she was like, his hearing is perfect. And that was the second time I wailed. Yeah. That was it. I was like, oh my, because by then he had been completing all his developmental milestones on time. He was ahead on some of them. And I was like, oh my gosh. I didn't consider until he was about 10 months old that he could have no consequences after the NICU. I thought it was which one.
Right.
It was that I never considered that he wouldn't have any.
It's interesting though. I, on the other hand, like, obviously I'm not going through this myself, but like I am hearing from you, talking to you as you're going through this. And the whole time you keep telling me, oh, he made it through this test and like no side effects, no consequences. And then we have this next test in like a month or two, right? Or a follow-up. And the whole time I'm like, nah, he's good. Like, he's got it. And I didn't say that to you because I did not want to spread this like false hope or toxic positivity. Like, I wanted to be there for you. But in the back of my mind, I'm like, nah, he's good. He's like, I see this baby all the time. He's good. And I just had this hope. And I think the other thing that I really want to say that I don't know if there's research backing this up. I have not done any research into this, Celeste. I'm curious to hear if you know anything about this. It's okay if you don't because I'm springing this on you. But one of the things that I think helped your son so much in the NICU was you physically being there basically 24/7. Like when you say you slept in your car, like you were in your car basically during the moments where there was like shift change and you're not allowed.
Where it couldn't be there.
Where you were not allowed in the NICU, right? Which is like at 2 separate points during the day, very brief periods. But you were basically in the NICU doing skin to skin, nursing him 24/7 as much as you possibly could be. And I think a lot about like, for moms, things that help our babies, especially in those early phases, is skin to skin, right? Your body temperatures regulate, heart rate regulates when your baby is physically on you. And then also I think about cortisol levels. And I'm not going to get too deep into the weeds on this, right? But cortisol is your stress hormone, right? So when you're under stress, cortisol goes up, and then when the stressor goes down, so does your cortisol level. And it's natural, right? 'Cause cortisol like rises as it falls and it fluctuates as is supposed to be with life. But when you are in periods of high stress for a prolonged period of time, right? So I'm thinking about your baby being in the NICU, not just in the NICU for 3 weeks, but he was obviously going through this for a few days before you all knew, right? And so cortisol levels are up and sustaining at a high level. But I think that you physically being there for him lowered those cortisol levels for him. And when the cortisol is high, it has all these health effects, right? When it's higher than what it should be or higher for a prolonged period of time, there is like this sequelae of just like negative health consequences that I think can really impact a developing baby.
Oh, for sure.
And my own personal theory, with zero research at the moment to back it up, is that a huge reason as to why he came out of this, scotch-free, is because of your level of dedication.
Yeah.
And I also will say, like, I think about this in two ways. One, it makes me so grateful for what you did and what you sacrificed, because that is a huge sacrifice. But then I also think about the parents who can't do that. I think about the parents, and Celeste, I'm sure you've seen this, right? The parents that have to go back to work while their baby's in the NICU.
Because they're there for months, right? You got to go back to work. It's, oh my gosh.
Or you have other kids at home, right? And so those kinds of things. So I'm curious, like, Celeste, what do you see in terms of like parents who just have different kinds of experiences in the NICU and who maybe aren't able to stay? And maybe some parents feel conflicted, and maybe some parents feel a sense of relief too, that because it's got to be so hard what you're seeing your child go through, that like, okay, I have to go back to work, and maybe this is my couple hours of day where like I can take a break.
Yeah.
And so like maybe there's some relief in that also, right? Everyone's having a different experience. So Celeste, I'm curious to hear what your thoughts are on that and what you've experienced.
Yeah, I'm so glad that you noted Anna's contributions, because I remember that you said, like, I think that what my partner contributed, like, that's the reason he's doing so well. And in my mind, I was like, it was both of you. It was both of your roles. And I think it's so special when both partners can figure out what their lane and their strength is, right? Because oftentimes non-birthing parents don't know exactly what they can be doing, because for both parents, you can feel really helpless in that setting. But if you can't breastfeed, or you can't pump milk, or maybe you're not the one doing skin to skin as much, like it's hard to know what to do. So it's amazing that both of you were able to contribute in that way. And to answer your question, Marissa, there's a lot of research actually that supports exactly what you said. So I think it's like naturally knowing how trauma works in the body, but definitely there's a lot of research that shows neurodevelopmentally how being there for your baby, skin to skin time, bonding, like all of that, really being present essentially is so important. Talking to your baby, singing to your baby, like all of those things are so helpful. And so what that does mean, though, is that there are likely disparities in neurodevelopmental outcomes because of that. And actually, we have a neonatologist that I work closely with, Dr. Melissa Scala, who this is like her focus of research, is in looking at disparities and how to help with neurodevelopmental outcomes. But certainly we see certain families when there is no choice, either because they live really far away or because they have older siblings that they need to care for, or they have to work financially, many reasons why they're not able to be at bedside. I worked with a family recently whose baby was there the entire year in the NICU, and they lived very far away and had another sibling and needed to work. And so they were only able to visit on the weekends. And so imagining, what that experience is like and how hard that is. And the population that we tend to work with is a lot of immigrants who are monolingual Spanish speaking, and oftentimes there's already a lot of barriers in that setting for those families, but oftentimes have limitations in their ability to be present at bedside. And so we've seen disparities just in terms of how those babies are able to kind of develop over time when they can't have a parent be present. So I think even though it can feel like you're not doing much, just being at bedside, and it's like, why am I tired all the time? I'm just sitting at bedside. And it's a full-time job being able to do that. And it's really, it's just an amazing privilege to be able to do that when you can for your baby.
Yeah.
Celeste, I want to ask you like one, I think, big question that maybe some parents listening that have been through the NICU probably want answers on, including me too. The hardest part for me, because I know you have to go soon, the hardest part for me still, all these years later after the NICU, is kind of like the spiritual struggle of like having been there and think that like, oh my gosh, like every mom in this room is going through this same very deep thing that I went through. There's a bunch of other NICUs around the country where there's moms going through this, parents going through it, dads. There's NICUs everywhere around the world. There are wars going on where people are experiencing child loss, and that's only in present time. But if we look at history, right, the amount of child loss was really common. Most people went through it if you had many kids. And that was, I think, the part that still sticks with me, I still wrestle with, I still have a hard time really figuring out is that my brain can't wrap around the enormity of pain of child loss that parents have experienced as just humans now and in our past, our own ancestors. How does that come up for you with your patients, and what do you say, I guess?
Yeah, actually, strangely enough, one of Marissa and I, mutual friend, when she had her baby for the first time, she told me about that sort of awareness of suffering of children that is like so different when you become a parent.
Yeah.
And so I think in some ways part of that is about being a parent, that you just like your understanding and sensitivity to suffering and children suffering and parents suffering is so heightened in a way that maybe you can't quite feel or understand before you become a parent. And then I think the experience of the NICU and understanding that others are going through it as well, it's this weird collective suffering, but also collective solidarity. There's also a sense of like belonging. It's like the club that nobody wants to be a part of kind of thing. And so I think that there's so much to that. And I think that, like you said, maybe spiritually, existentially, I think a lot of people go about processing that in different ways. It certainly helps when you can feel like you and your child have healed together. I think when your child still has ongoing medical needs, or there's still some uncertainty or that sort of thing, I think the processing can be more challenging. But still, people co-create with their child like beautiful meaning and understanding of what all this experience was to them. And you spoke to, wanting to get into advocacy. I think a big piece that we actually see is parents wanting to give back and wanting to be more involved. And so I have seen people over time be able to provide support or be involved in ways that also helps bring meaning to their experience. So I think maybe that's an ongoing journey that parents go on. And we have talked to parents like decades after their experience. And these parents are ones that sign up to be involved in research studies and things like that, because it still feels meaningful for them to give back in different ways.
Yeah.
Wow.
Oh my gosh.
Well, I know, Celeste, that you have to go. I want to ask you one quick question, and then you can hop off, and Anna and I will close out. But this is a very heavy topic, and I can't imagine what you do on the day-to-day, just being in the throes of it in the NICU. But what are some things about your job, or what is one thing about your job that brings you joy? Like, where do you find your joy amidst all of the chaos?
It's a great question. I love ending on this one. So the reason why I was first drawn to this type of work, like mother baby, dad baby, like all of it, was the magic of that relationship. I think it is just the most beautiful thing in the world. And the only thing that's more beautiful is seeing parents be able to do what Anna did for their children in the face of trauma, like in the face of grief and trauma and all the things that are coming up for you. And you still just show up for your baby in a way that is just absolutely sometimes like superhuman. Like somehow you figure out a way to do it. And it's just incredible to see the way that parents do that and the love that they have for their children, and to be just like a small witness on their journey while that's happening. It feels like an immense privilege. Like it totally feels like an honor. I feel like this type of work is like bestowed on people. And I feel very special to have like fallen into this role. It truly just feels like an honor to be able to provide that.
Oh,
Yeah.
I love that. That makes me teary-eyed.
Yeah. And Celeste, I'm going to also say, I I don't think that you are a small witness to what people are going through. I'm going to bet good money that if we talked to your patients that have gotten to work with you in the NICU, you are not a small part of their journey.
No.
You did not fall into this.
They
Girl,
probably
trust
remember
me,
you
I know you.
forever. Yeah.
If I could do a podcast bragging about all the things that Celeste has done in her career, just like all of your work. And so I think that you are hugely influential for this population, for these families. And I wish there were more NICU psychologists. I wish
Oh
that
my
there were,
gosh, yeah.
like, if there should not be a level 4 NICU that doesn't have a psychologist in it, or a
Mhm.
whole mental health team
Yeah.
for that matter. But Celeste, I know that you have a patient, so we'll let you go. I don't want you to be late to your session.
No
So Anna and I
problem.
will close out. But thank you for being our very
Thank
first
you.
guest,
Thank
Dr.
you
Yay.
so much
Celeste
for having me.
Poe.
This was such a wonderful conversation. I really appreciated the invite and
Yeah.
so glad to be a part of it and kind of just, sharing more about the work with more people.
Yeah. Well, who knows? Maybe there will be some room for a follow-up.
Yeah.
I don't know. We'll find an
Yes.
excuse to bring you back on the
Yeah.
podcast
Yeah,
We'll
at
I'd be
find
some
an
happy
point.
excuse.
to.
Okay. Thank you,
Take
Celeste.
care.
Take care.
I think we'll close out here, but I think one thing that I don't want to lose very quickly that I just want to go back to is like, man, hearing you talk and Celeste talk about parents, how important it is for parents to be present in the NICU,
Yeah.
and then knowing that some people have to go back to work.
No, they have to.
And I
Yeah.
also want to say, like I kind of mentioned earlier, I think that there are parents who probably want to go back to work, and I fully understand that,
Yeah.
right? Like, again, it is so incredibly overwhelming
No, yeah, you can't do that forever.
that
It
sometimes
just, it
going back to
sucks.
work is your relief, it's your break, right? So I'm not talking about necessarily those parents, because if that's your break, girl, take your break.
Yeah.
Like, do it. Absolutely.
Yeah.
Don't have that guilt. Because like we mentioned, I think it was in our first episode, that taking care of yourself is just as important as taking care of your baby. And
Yeah.
taking care of yourself is a form of taking care of your baby.
For sure.
But for the parents who want to be in the NICU, like, there should be, like, we should
every
not,
resource should be available
every
to them.
resource.
Yeah, I don't think that, to
You
be
should not
honest,
have to go back to work.
I should not have been sleeping in my car
No.
as a breastfeeding mom.
I mean, you shouldn't have been sleeping in your car. Should have been some avenue for, we need to be able to figure out how you can, at least drink water, even if you can't
Yeah.
eat in the NICU, at least drink water. Or like, parents should have job protection when their child is in the NICU.
Yeah.
Good Lord, that should be
Yeah.
a bare freaking minimum,
Yeah.
is that you're not like, oh, I got to go back to work because I could lose my job.
Right.
Or I have to go back to work because of this bill. Like,
Mhm.
no, we
Mhm.
need to be able to figure this out.
Yeah.
Ugh,
Yeah.
okay.
I know.
I
I know.
I didn't want to go on that rant before Celeste left, because I wanted her to answer that last question before she
Yeah.
had to go. But like, I couldn't end the episode and not talk about what a travesty this is, and how this
Yeah.
is, something that absolutely needs to be changed.
Yeah. And I have like probably at least two calls to action for this episode.
Yes.
I think the first one is, there is some, actually I wrote it down here so I remember to say it, but there is some research that talks about like NICU babies. So there's one study here in 2007 that emphasized that the NICU stressors, the bright lights, the noise, the
Mhm.
separation from parents, can actually impact a child's self-regulation abilities. They're I think parents will often describe them as like they're very intense, and I've said that to you. Like,
Right.
Rain is
Your son
very
is
intense. Yeah. And they have higher sensory reactivity too. And I would definitely say that's him. Like he responds to like blenders. He really doesn't like blade. Like he'll cover his ears, and like go in another room with blenders. Some of that is from the beeping and all the constant noise
Right.
in the
In the
NICU.
NICU, yeah.
Yeah, and the bigger thing that I want to highlight about this fact is that there is some research. This study was done in 2019 that parents of at least full-term NICU infants were more likely to exhibit overprotective parenting styles, and that can then mildly increase the child's anxiety or like cautiousness behavior. And I would definitely say that was me. I think because for those 3 weeks, I was just so like, he's not going to know pain. He's not going to know. The only pain he's going to know is the pain that he has to go through for him to get better.
Right.
Other than that, when he cries, I will be there. When he wants this, I'll give it to him. Like whatever he wants for those 3 weeks, he's got it. But then once we come home, I didn't exactly turn that off, which can lead to like a whole host of other things, right?
But
Because
like, good Lord, how hard it must be to turn that
oh
off,
gosh,
given
yeah,
what you went through.
it probably took me over a year. And probably having my second kid to actually like experience some normalcy around that. It took me a long time. But I want to highlight that like there is like with attachment stuff, there was like respond to your baby. You can't respond to your baby too much. I will say I responded to him so much in the first year of life that I almost never gave him a chance to experience frustration
Mm-hmm.
or any amount of distress. And that's important
Mm-hmm.
to then developing frustration tolerance and
Right.
all these other things, right? So I guess my first call to action is to just be aware of that. If you're in that situation as a NICU parent, or maybe your child went through something horrible, right? Maybe even a teenager, how you can want this like urge to like really like protect them from everything. And to a fault. To a fault. And so just knowing like it's a balance. It's not, I'm not saying like stop doing that, because it's not as easy as that, right? If somebody would have told me that, I would have been like, no.
Right.
But it is a balancing act to like try and like figure out how to step back and let him develop in the way that he is supposed to. And I've been able to do that much better, but it was a journey to kind of back off a little bit and let him experience the pains of life.
Yeah, you had to let him experience the world. And the world includes
pain.
Yeah.
And that's hard as parents. That's probably the hardest part, I think, as parents.
Yeah.
But I will say though, because this is important for all NICU parents to hear, is that research also says that once the babies enter school age years, you don't see that level of emotion dysregulation anymore in the babies. The anxiety usually tends to reside, like go away and all this stuff. So it's not something that they deal with for the rest of their lives.
Long-lasting.
Yeah,
it's just
according to the research, right? Yeah, they'll just struggle for a few years, and then once they enter school, they'll probably just level out like the rest of their peers. So that's the good news.
Yeah.
My other call to action is that this is for everyone. This isn't just for like NICU parents, but this is for everyone that has to go to a hospital for any reason, right? Maybe you're giving birth. Maybe you have your own procedure coming up, right? Anything like that. There is this acronym that I want you to remember that I think really came in handy for me and my partner, because we had just given birth 3 weeks before this. So it was in the top of our brain as we were going to the NICU. And it's actually called BRAIN. So the acronym is BRAIN, and look it up if you want to, but it basically stands for benefits, risks, alternatives, intuition, and just saying no. And it's this idea of like, whenever a procedure is like a doctor is telling you, hey, we have to do this, or, oh, you need Pitocin, during delivery or whatever it is. Okay, well, what are the benefits? R, what are the risks? A, what are the alternatives? So for example, Pitocin, if I don't use Pitocin, what else can I do? I is intuition, because I think we don't give that enough attention. But what is your gut telling you in this situation? And then N is no or not now, or something along the effects of let me think about it. Come back in a few minutes and let me think about it a little bit.
Yeah. And this is a great tool, not only to be able to advocate for yourself or in your case for your baby in a very high intensity, high stress situation, right? Where your mind might feel quite chaotic, right?
Yeah.
This can really help ground you and provide some clarity. I'm like, okay, what are the things I need to focus on? And go through this acronym because it can be incredibly helpful, not only to advocate for yourself, but to help ground yourself in a very chaotic moment when you're having stressful conversations with medical providers.
Yeah. And to end this on a happy note, I will say that the NICU experience really made me love moms.
Yeah.
I really felt, in those first 3 days of his life, I saw the beauty of motherhood, a newborn baby, and just, oh my gosh, the oxytocin. And then in the NICU, I saw the other side of motherhood. And that made me really, really love moms and working with moms. And it's a big part of why, like, we're even right here right now. Is like this like huge thing that I have to help out moms, help out parents, and I don't know, have something there to help me feel like it was all worth it. I don't know, in a way, I don't know.
And I mean, here you are almost 3 years later, and I just like I think about everything that your son went through, and all of those very tough moments. And I think even that is an understatement.
Yeah.
But what was it, like 3 days ago? Our two sons, who are both almost 3,
Yeah.
were like sitting on your porch.
Oh my gosh,
Eating popsicles by themselves. They were just kind of sitting on the porch.
They were
They were
chatting.
swinging. They were chatting about bath time.
It was a rainy day too.
Yeah, they were chatting
Yeah.
about bath time.
Oh my
And
gosh.
it's just like I just like was watching that, and it's just like, man, what a sweet moment.
Yeah.
Right? Like I think sometimes when you're in the throes of whether it's challenges of parenting in general or NICU things, miscarriage and pregnancy loss things, right? Like the moment that we got to experience when we watched our boys eating their popsicles, chatting about bath
Yeah.
time, you know, like that is the other side of it.
Oh my gosh, yeah.
That is like the joy that we also get to experience as being parents.
Yeah.
Oof,
I
wow.
know.
You made it
Super
through
good.
this episode.
We did. I made
Mhm.
it through the episode.
Mhm.
If you're a NICU mom, I don't know where the camera is. I see you. I see you,
Which
NICU
camera do you
mom.
look into? Yeah.
Yeah.
And yeah, if you're a NICU mom, a NICU parent, go to therapy.
Go
I
to
mean, we're always
therapy.
going to advocate to go to therapy because we're therapists, like, so we're going to tell you to go to therapy. But
Mhm.
like, if you're a NICU mom, a NICU
Yeah.
parent, go to therapy.
Yes, I did. I'm a therapist. I'm a psychologist, and I did.
Mm-hmm.
Yeah.
Yeah.
Yeah. I
Okay.
think we'll end it there.
Yes.
Marissa, where can they find us?
Yes, you can find us on Instagram and TikTok at Not Your Mother's Therapist Podcast and at Not Your Mother's Therapist Podcast at gmail.com. And Anna, what are we going to be talking about next time?
Ooh, raising boys.
Yes. I'm looking forward to this one.
Yeah.
Yeah. Being moms, we're both moms of 2 boys.
2 boys.
Yeah.
Mhm.
I'm looking forward to this one.
Mhm.
So thank you for listening, and we will catch you next time.
See you next time.